The first question, of course, to ask is family violence a problem? And if so, how big a problem? Well, we've got good survey data here from Aotearoa, New Zealand. 50% of both men and women, or more than 50%, reporting intimate partner violence.
Family violence is literally making us sicker at the population level. And it's a topic that we think affects only a few people, but we've done a lot of research over the years which is showing us how common it is for the population. We've known this for a while, but we fail to engage with it as a health issue. And it's not just health effects in terms of injuries, it's health effects in terms of people's mental health. It's physical in terms of chronic health effects. So we're seeing the association between experience of violence and trauma in terms of cardiovascular disease, increased risk of cancer, increased risk of diabetes.
Living in a violent relationship creates long-term health problems that people end up with. The longer people are having to live in those environments, particularly children, that's going to impact on the future of our people going forward.
55% of women experience some form of intimate partner violence in their lifetime and are at almost 3 times the risk of having a diagnosed mental health problem. And they're at 1.5 times the risk of experiencing a chronic physical health condition like cancer, like heart disease. We know that those who experience violence and trauma have increased inflammation, increased toxic stress response. People respond to that in ways to try and reduce that stress. So they may smoke more, they may drink more, they may eat more, they may eat less. All of those high-risk behaviors that we screen for routinely in health situations may be their responses to trauma. And if we only stop at screening for what's a symptom, we don't address the underlying cause.
So many of the issues that I went through medical school learning about are actually less prevalent in the community than violence. And we know that violence affects children lifelong in a way that many of those conditions do not. There's a huge conceptual gap. And what I mean by that is that most health professionals don't see violence as a health issue, receive next to no education about family violence. And you'll be working in the community or in a hospital where roughly 10% or more of the children you see are living in situations where violence is occurring regularly. And we don't see it as our problem. So we don't ask about it. And when we do discover it by accident, we're often untrained into what to do.
In New Zealand, we've built our own version of this system, the Violence Intervention Program, which should be one of the world-leading programs in the area, and the infrastructure is great. But we are failing at getting this listed as a priority and people really spending the time and putting the emphasis that they need to putting this into practice. And we need to be equipped and make sure our health services are equipped to address that.
Well, one of the key advantages that both the health and education systems have is that we are routinely in contact with families. Why don't we use those people to intervene? I mean, the health professionals are in a far better place to do that. So we have an opportunity to transform the lives not only of the health professionals that we're working with, but the families that they're working with.
A visit to a healthcare facility can actually be part of a person's safety plan. So that interaction is a really important one, and it's important to both identify the presence of intimate partner violence, but also then to respond and put in place those protections.
Whānau will engage with health services long before they come to the attention of police. You might be the one person in this person's life that makes a huge difference.
Economic cost for this country every year is something in the range of $4 to $7 billion per year is spent on dealing with the results of violence. Well, why don't we invest 1% of that in getting a better outcome from the health system?
There's no doubt that we need to do better on this. One of the critical things about whether or not this is done routinely or more routinely is good organisational leadership, structures, training, resourcing available, and then of course having those referral pathways in place so that clinicians are able to refer into services that will then assist that person. Just as important as diagnosing any physical or mental condition, is identifying and responding to intimate partner violence.
If we're willing to step up and take violence seriously as a health issue, we could get a catalytic change in the overall burden of health for the country. If we want to take violence seriously as a health issue, let's do it. Let's change the story.